Renovating occupied space in healthcare facilities can challenge even the most experienced interior systems contractors. Because the well-being of patients and staff must be their first priority, healthcare facilities maintain uncompromising standards for projects in occupied space. Contractors in this growing market need professional interior systems carpenters with the specialized skills and awareness of patient safety to meet the ICRA protocols. That's why the United Brotherhood of Carpenters International Training Fund and industry leaders developed Infection Control Risk Assessment ICRA Construction Trades Best Practices Awareness Training. In 2008, St. Joseph's Hospital in St. Paul, Minnesota, initiated a renovation program to enlarge their patient care facility and bring the hospital up to new fire codes. The contractor, McGuff Construction, faced considerable challenges to work in this environment.
Imagine we're working now in an occupied existing hospital, immediately adjacent to surgical suites, to ICU, to CICU, and the need to be sensitive to airflow, to dust control, to infection control.
The Carpenters Union recognized the need for specialized training and worked with McGuff to create a Best Practices Infectious Control Risk Assessment, or ICRA, certification program. The UBC International Training Fund quickly saw the value of the Minnesota training and expanded its scope.
And the International took that information that we locally developed, and now we have an excellent training program that will be able to be given to the rank and file all across North America.
In Western Pennsylvania, the University of Pittsburgh Medical Center and the Carpenters formed a partnership to develop a unique Best Practices ICRA program that centered on greater awareness of patient safety.
When we were looking for best practices and trying to have our trades understand what the hospital was about and how their impact is on our hospital, we found the Carpenters Union had a wonderful program in place.
UPMC's top construction managers went to the union's Pittsburgh Training Center to find out more.
The UPMC officials, Tom Kennedy, came to us and asked if we were doing any work in hospital construction. We showed them our 24-hour course.
When we found out that the Carpenters had this program for training their people, it was exactly what we were looking for. Except we wanted to expand it.
Then came along Jeff Clare, who is the infection control coordinator. He took a look at the course and said, we need to have this.
I was really impressed by the amount of detail, the scope of the total class, and really how the whole piece was put together. It was taking our concepts of what we need to do and not just telling people that they needed to do this, but why they needed to do it.
So what we did is we put this 8-hour awareness course together so we could disseminate that out to the group, to the entire construction community, the contractors, the workers, all of the craftsmen, the project managers of the facility themselves.
How much dirt are we going to make on this project?
The course covered how to follow the protocols, but it put more emphasis on the reason why they were mandatory.
The why, to me, is the piece that always has to be put in. If I can't get you to look at the human factor of what your actions can have as an impact on a patient, then I'll hit you with what the financial impact can be and what it can do to your job.
If we're going to be in an ICRA containment, we need to know how to work in that environment. So we put it out there for our installers, and UPMC did say in the coming months that it was going to be a requirement for anyone working in the field.
Once the ICRA Best Practices Awareness Program was deployed, UPMC construction managers recognized the effectiveness of UPMC's partnership with the Carpenters.
I think they've done a wonderful job in taking ownership along with us with infectious control and understanding everybody has a responsibility with it.
And what we've seen out of this is that UPMC's job sites are cleaner, they are more efficiently run, we are having less issues with breaches or people doing the wrong protocol outside of our containments. It's a program that has transformed what we're doing in the region.
On the UPMC's occupied space projects, the Carpenters' best practices continue to set the standard for rigorously observing the ICRA protocols.
We want every piece of tape, every piece of plastic, every HEPA machine, every pipe to be placed properly so that when someone looks at it, it calls out that the entire process is professionally done.
The Carpenters worked out superbly. They already come trained with their certificates from best practices, and and you'll see the outcome of their training.
That's because the UBC's Best Practices Qualification Program gives its interior systems carpenters the targeted skills, highest productivity, and solid attitude that always puts patient safety first.
If we as carpenters can do construction and do no harm, then we're doing the right thing for the healthcare industry.
Until they get it. And so it's all geared towards patient safety. It's been a great program. It's a great collaboration between us and the carpenters.
The Best Practices Awareness Training is an initiative of the United Brotherhood of Carpenters and Healthcare Facility Operators. It delivers the most effective and most reliable containment of infection for construction and occupied facilities throughout the industry. Infection Control Risk Assessment, ICRA, Construction Trades Best Practices Awareness Training, a partnership for patient safety.